In fact, if I can just ask Mohit Bhatnagar, I mean, all this work that's been happening and how the priorities have changed over time, it's a moving, the way you have an impact is changed during the course of this pandemic, right?
Prannoy, I mean, look, we started off like most, first just focusing on PPEs, which is providing protective equipment to our doctors at the healthcare, front. We then moved our efforts towards testing to just try and get a lot more testing done across India. But frankly, right now, our focus is on three very specific things that we found to be scalable solutions to really fight back the spread of the disease. The first one is home management. The good news about this is about 85% of people who get COVID can be treated at home, but we cannot let them panic. So there is a whole host of telemedicine solutions where volunteers, doctors, call patients, help them understand the protocol, manage their temperature, their symptoms, and allow them to stay at home while they recover. The second is for those patients that need to be transferred to some of the medical facilities that the government is running, we've actually helped with oxygen therapy solutions. If you can get folks onto oxygen solutions, whether they're the low flow type on concentrators or just oxygen cylinders, or the higher flow solutions like Shekhar talked about, like HFNCs, that's been a second massive focus for us, and we've evolved as the disease has evolved. Something that we're really excited about that we think will be helpful for India as the disease spreads to small towns and cities is to provide a remote ICU capability. Think of all the small towns and cities of India that don't have intensivists. How can we have a central set of intensivists sitting in the larger cities of India, remotely managing with doctors locally present, folks there?
Yeah. Excellent. Yeah, good point actually, a great idea.
मोहित, मैं आपसे यही जानना चाहूंगी, एक तो आपकी जो मास्क अवेयरनेस, डिस्ट्रीब्यूशन अवेयरनेस के बारे में, और जो आपने ये रिमोट आईसीयू की बात की है, किस तरह से संभव हो पाएगा, इसके लॉजिस्टिक्स क्या होंगे? Have you worked on that strata?
Absolutely. You'll hear today on this very show from our partners like Cloud Physician and Pretty ICU. They have now deployed hundreds of beds all across Maharashtra in the smaller towns and the smaller cities across India. The way it actually works is you actually have intensivists who tend to be actually sometimes more senior doctors who sit remotely, use cameras to be able to get access and use sensors to get access to some of the patient data, who then work via telephonic links with doctors who are locally present there in order for having them administer help and support to the patients. In this way, we can actually have one doctor who normally would have supported only 15 or 20 patients if he was physically present to actually support closer to 75 or 100 patients. And that scale is what will help us service this need in smaller cities and towns of India.
Right. Well, Mohit and Shekhar, thank you both very much for being with us.